Abdulla, tell us about the infrastructure of Abu Dhabi so people understand what the health system looks like in the UAE.
In the UAE, we have the Ministry of Health, which works on Dubai and above, and we have the Department of Health, where we come from. The Department of Health of Abu Dhabi is responsible to regulate the healthcare sector in Abu Dhabi. We have about 1,700 healthcare facilities, 48 of which are hospitals, and around over 170 different nationalities working in the health sector just in Abu Dhabi. Right now, we shifted our ways of auditing in the Emirates, and we went towards the ranking systems and starring systems for the hospitals. So what we are trying to do is to put the choice of getting treatments in the hands of the patients. We want them to go just like how you go and book a hotel. You can book a 5-star hotel, 4-star hotels, 3-star hotels. We are applying the same system to hospitals. And part of this ranking system comes the innovation part, which will be presented by Dr. Dirk. So this system is generated by our annual audits on all healthcare facilities, and the audits are on all areas in the clinical care, so it includes clinical practice, infection control, and medical equipment and everything else.
Yeah. Lovely. Thanks very much. Obviously, Abu Dhabi is a manageable system. It's kind of configured, it's small enough, and I think it's got great potential. So Dirk, would you like to talk about your vision and about healthcare? They'd love to hear about it. Thank you.
So, first of all, we would like to invite all of you to come to Abu Dhabi to see what happens in Abu Dhabi and the United Arab Emirates. Very many things are digital already, and now it's up to us to make health as digital as possible. Abdulla already told you it's quite a huge region, a lot of desert, but looking at the region where people live, it's relatively small, so it's a perfect region to pilot things. Talking about 50 hospitals and some healthcare facilities, so things that can be done very quickly, and that's also one of our advantages for innovation. So we are working for Abu Dhabi government, and there are basically 3 goals why we think we need to push innovation and digital innovation in our region. One is, of course, we want healthcare to improve. We truly believe we need innovators in our region, not to buy innovation from elsewhere, but really innovate in our emirate. The second thing is, of course, this is part of a long-term strategy to become independent from oil, so we need to diversify economy. So far, the leadership always looks at us as a cost factor. Healthcare is too expensive, all of you know. Now we try to contribute to GDP by actively promoting innovation. And the last thing, very important as well, there might be some rumor in this region, people coming and going, nothing is sustainable and only very short term, and people leave. Very clear, what we will show you now is something it's not like related to some person, not to me, to Abdulla or anybody else, to our undersecretary, but this is something sustainable that should be long lasting and really transform healthcare. Now, we will elaborate during the discussion, we have created the so-called Health Tech Hub in Abu Dhabi, and what we try to do as government is to really cover the full ecosystem, starting with education, looking at the innovators of tomorrow, educating communities, bringing really immature startups in to support them. We do the incubation part, which is of course starting from ideas to products to prototypes. We are the regulator, so we are able to create innovation-friendly regulation. Talking to startups, I quite frequently hear it's very difficult in the US or in Europe to get POCs done since there's so much regulation. We are the regulator, so working with us means we can look at your pilot, at your POC, and think about how we can make it as easy as possible, connect you to partners. We have partners like Hub 71, which is a government initiative as well, funded with almost more than $5 billion for startups. So there's a lot of money, of course, not just given to anybody, but really based on criteria. We're also working with partners like Plug and Play, who help us to accelerate businesses. So that's what we do in Abu Dhabi. I wouldn't like to go too much into detail, but each partner has a specific role, and we as Abu Dhabi government support everything so we can help with regulation. We're also custodian of government budgets and of insurance coverage, so everybody's insured in Abu Dhabi. So if there is any new technology that should be implemented in the market, and we are convinced this is something that will drive quality, save cost, improve healthcare, we are able to support and get it covered by insurance, which is an issue in other markets as well. So I think what we can do is really to work with all of you, coming with innovation to Abu Dhabi, trying to establish, to pilot things, and from Abu Dhabi to the world, the region around, a lot of Arab-speaking countries, potential hundreds of millions of people. So Abu Dhabi is also a perfect hub to go from there to the rest of the region and get those solutions implemented in other markets as well. I think we'll be able to give you some more details, and happy to.
Thank you
the temperature is like fireside chat. That's a good thing.
Yeah, we do it intentionally for you. So that's great. So look at that. How amazing is that, right? They've raised 5.5 billion to innovate, change, and transform in a country that's connected. And when I was there, actually, I was really impressed. I was there for a day, and they showed me around your World Market building. Is that the World Market building?
Yeah.
They've got 2 floors. So tell me more about your space for innovation at Dirk.
Yes, I mean, we have what I showed you. Hub 71 is initiatives that will include all kind of industries, all kind of pillars. And what we have is first of all, this Abu Dhabi global market is a free zone, so a special regulation. Cleveland Clinic Abu Dhabi is also part of it. So we have healthcare providers, we have a lot of things, and we have co-working space across 5 floors, bringing in innovators from all industries. So there's a lot of interaction. We have Plug and Play, we have consultants, we have different people. Microsoft is founder of Hub 71, as well as SoftBank. So there are different people. And what we, of course, all of you know, healthcare is not about healthcare professionals creating innovation, but we need all those different industries to meet, to interact, and to create a hub for innovation.
So startups are kind of attracted. They want people to come and innovate with them together. And the other thing I found out about Abu Dhabi when I was there, they've actually changed legislation to fast-track innovation. And I heard about that 30-day thing that you're doing. Tell me about that 30-day rule. Abdulla, do you know about that? The implemented fast-track change 30 days.
The fast-track, the 30 days of...
yeah, so you've got an idea, go to market, implement it, see if it works or not, right?
I don't know about...
you know much about that?
Yeah. I mean, what we already told you, what we try to do is to establish and provide the full ecosystem from proof of concept to the market. And now what we did is to create a technology evaluation committee. So we will look at your technology and do a cost-benefit analysis and all the thing, and then we will approve it for the Abu Dhabi market, and we will also include it into insurance schemes. And that's the ambition, is 30 days. You always have to have a target, you know. I mean, what Europe did in 200 years was done, I think, in about 50 years, or even less in the UAE, so it's not 90 days, it's 30 days for us, and let's see, maybe 31 in one or the other case, but the ambition is really quickly to the market. And that's what we...
It's amazing. So it's really really exciting. I think I've been around the world, and Abu Dhabi is really exciting. They're understated. Don't go on about it. There's no huge banners like Dubai and other places. They're kind of getting on with it and delivering it, which is incredible. What I was really impressed with when I spoke to the guys at Abu Dhabi was your healthcare information exchange, okay? The connected, all the data. Tell me more about that, Abdul, if you know about that, because you've done it already compared to other countries.
The connection of data.
Yeah.
Now, like what's interesting in Abu Dhabi, us as Department of Health, we control the private sector and the governmental sector. Yeah. So everything is under us. Anything they do, and even now you have we monitor all emergency departments by video. So even in emergency response, as soon as an accident happens, the control center tells the ambulance go to this hospital because it's empty. This is all because of the integration that happens, the data that we have.
Yeah. So I was really impressed. So what I was impressed with, we're all struggling with interoperability, integration, the key words that we all struggle with around the world. But actually what they've done quietly in the back end is connect with the hospitals, with a central healthcare information exchange. So today, they can collect data from everywhere. And because private and public are connected, it's a fabulous resource. For those that want to do research to help support the program, they have the access, right, Dirk?
Right, yeah. I mean, what happens already today is that all kind of insurance claims are going through Department of Health. So we know whatever happens, and everybody's insured in Abu Dhabi, so whatever happens, all the data are with us. Of course, there are data issues, we continuously improve them, but in some months we will launch our health information exchange project, and then all the clinical data will be in one place as well. It's not like we sell data, but we understand that data are very important for many innovative ideas. So we will be able to provide data. There is, of course, certain restriction, of course, the confidentiality and all this, but still we will be able to give a full picture of whatever happens in healthcare in the Emirate. And this is beneficial for each patient. All this duplication of all the examination and visits and everything will be a story of the past, but at the same time it's very helpful for us and for all people who require data for AI application, everything else, to build on this database, and that's something we the public sector will be included in summer already, private sector by the end of the year, and then for 2020 we can offer the full set of data.
I find that really exciting. I think that we will talk about data all day today, about how to use it, how you transform it. Here we are, a perfect ecosystem where you've got data, you've collected it from all sources, and they've got to figure out now how to utilize it. It's almost like the perfect springboard to kind of innovate in healthcare on a large scale. So I'm really impressed with that. Feel free to raise your hands for any questions. I think this is really useful to get their insights from another country in terms of how they innovate healthcare. So can you give some examples of what you've done so far in innovation, Dirk or Abdulla, and how you've taken that into the market?
We'll tell them about donor. So now one of our startups that came to us in less than a year, from an idea to something that is going that is used now in hospitals, is the tracking system in badges and IDs and wristbands of the patient. So basically, this you as a hospital, you can monitor each room in the hospital and who's inside it. Like if you will see in a monitor where is the patient, and if there is a nurse is with him or a doctor, and you can monitor by time who is late, the patient or the doctor, or an OR, did the doctor come, or this is all tracked by small chips in either the patient wristbands or the doctor's ID badge.
And they were doing some, when I was in Dubai, they're talking about this whole telephone triage system that you have in Abu Dhabi, is that right?
No.
Telephone triage or telemedicine platform, I can't remember. They're talking about something that was quite forward-thinking. Do you know much about that, Dirk? Access to telephone doctors immediately.
Yeah. I mean, that's one of the initiatives. Our region, I didn't really give you the full picture. Looking at Abu Dhabi, there is Abu Dhabi capital and another big city, 500,000 and 1.5 million, but there's a lot of remote regions. So one of our challenges, like maybe Scandinavia and other countries, we have some remote regions who don't really have access to healthcare. Or the other way around, we build healthcare facilities, very expensive. Doctors are underutilized, so surgeons do one surgery per week and things like that, which just doesn't make any sense. So our initiative, we have a telemedicine center, but it needs much more applications, much more progress, much more innovation to really bring healthcare to those remote regions. So we have, for example, just to give you an example, diabetes, perfect indication. We have Imperial College London Diabetes Center in the capital. So really one of the best providers all over the world in terms of diabetes care. Now our challenge is to bring it to everybody's living somewhere remote in the desert. And those are all the things we're discussing now with innovators to implement this. And that's something we need to achieve.
Any questions from the audience? Feel free to ask questions and really interrogate these two. So, yes, a question over there. Do you get a mic over here, please, on this side? Can we get a mic, please? Microphone over here. Thank you. If someone grab that. Yeah, one of you, thank you. So, if you just tell us just give us your name and then ask the question, thank you.
Hello, my name is Prof.
Can we put the microphone on, please? No, they'll turn it on, they should turn it on. Yeah, it's working.
Hello, Prof from Musalasoft, a Bulgarian company dealing with innovation. When you're talking about innovation in healthcare, I have a couple of questions. One is, how do you measure results? So what are the KPIs or success factors that you track whether the investments in innovation are successful? And the second is from the point of view of the citizens. Can you give us some examples of, let's say, positive feedback and people that really felt the innovation that you provided in healthcare? Thank you.
You want to? Yeah. Now, we have to distinguish, and it's very important for us, between government KPI in terms of innovation and more investment-driven KPI. I mean, for us as a government, we look at, for this initiative, we look at the number of startups registered, we look at the number of proof of concept projects, we look at the number of innovation of projects being implemented in the market. Very clear KPIs monitored by the so-called Executive Council. At the same time, and I think Shafi already pointed out, talking about those $5.5 billion that are also provided by a public investment fund, Mubadala, they look at pure investment KPI. So there is no one, it's very important not to mix politics and private businesses and investment. So those people look at all the things that any other investor would look at sustainability, as a team, a business model, return on investment, and all the things. So there are two things. For us as government, we have to build the whole ecosystem. Those funding, of course, we also have angel investors for early stages, but this public funding is really directed at creating business and return on investment. So they have investment criteria very similar to any other investor all over the world.
Yeah, regarding the benefits to to the people, because we are government-based, we don't look to how much money we are bringing in. So we are purely, all what we think about in innovations and programs and startups is to help the people. Like, for example, right now in Abu Dhabi, with our app developed by Department of Health, and because of the connection of all the data of private sector and governmental sector, with one app you can search for a doctor, choose like a female doctor or a male doctor, choose the specialty, and see his rating, and the rating is by the people, and then book an appointment with him, all with one application. And even there is a map that tells you where, the route that you have to take to reach that facility. So all what we do is just to make the life of the patient in Abu Dhabi easier. And this is why the innovation was included in the innovation was included in the ranking system of the hospital.
Thank you. Any other questions from the audience? Okay, so for me, for you, is there one? Yeah, please, microphone over here, please. Thanks, Sylvie.
Dr. Guriel from Bulgaria. So my question is, how can we use the digital technology to work about prevention, not only about the treatment? And do you have some experience in this direction? And also, how can we use the digital technology to make big data research? Because this is a new opportunity because of the digital technology. Thank you.
First of all, I would like, maybe I forgot to introduce we are really very much impressed by what Bulgaria achieved during the last years, and I didn't really know when I came here, but you became a role model for us during the last 2 or 3 days. So a lot of things you already achieved. We'll follow you and maybe overtake you sooner or later. Let's see. Yes, regarding your question, I mean, I really loved Daniel Kraft's concept of healthcare and sick care. Of course, I mean, looking at the challenges we have in healthcare, we know there's no way to build another 10 Cleveland clinics, Abu Dhabi, to treat all the patients. Really look at prevention. There are already a lot of programs in place, mainly focused on the UAE national population. There's screening programs, annual checkups, and all the things. And now the challenge for us, when we're talking about genomics, all the things, the challenge for us is really to include all this innovation into those programs. So, I mean, the good thing, the process is in place. So there are screenings. Now, all of you know, the screening as of yesterday is totally different from what can be achieved tomorrow. But the challenge for us is now to work with all of you and implement solutions like risk assessment based on genomics, other tests, remote things like blood pressure control, all the things we saw today, to include this in the process. But since this is all led by the Department of Health, so we are the ones to mandate providers to do the screening. It's very easy for us to include reasonable kind of innovation in the prevention process. It will save a lot of money and, of course, improve quality of life. Big data, the question I would like to give back to you. I mean, we will have big data. We already explained you a health information exchange, so all the data are in place. I can tell you our corporate challenges as Department of Health is, of course, planning in terms of facilities, in terms of programs, and we have a so-called Innovation Challenge Tip Healthcare award, and one of the challenges for this year is, of course, big data. 2 challenges: one is assistive technology for people with disabilities, and the other one is big data in healthcare. And the corporate partners are Department of Health and our national insurance company called Daman. Both are the ones who really have the ambition to work much better with all the data we have, and that's something we would like all of you to come up and help us to innovate.
So there's your kind of invitation. And I would really take up on it because I was really impressed with, as I said before, what they're doing. Now, Dirk was telling me yesterday over dinner how impressed he was with Bulgaria in terms of the Webit.Festival, in terms of the maturity of your thinking, the ecosystem of startups, also your transformation. And they see themselves as an early Bulgaria in some regards, but maybe with more money coming in to drive it forward. Is that right, Dirk?
Right, yeah. I mean, the good thing is there's healthcare in place, we have a lot of data, and there's also funding available. So I think, and we have people like Shafi to support us. We didn't announce so far, by the way.
We'll announce in a second.
We'll announce in a second. And now we really need to follow what Bulgaria already does and customize to the region. I mean, Abu Dhabi is not Bulgaria and the other way around, but at the same time, there are a lot of countries around who have faced the same issues, so there's a lot of potential beyond Abu Dhabi.
Thank you. Abdulla, why should people come to Abu Dhabi? What does it offer? Tell them. Sell Abu Dhabi.
What I want to say is, if you want to Google and search for my country, say 40 years ago, not even 50 years ago, all pictures you will see is desert. But now you will see roads, biggest mall, tallest building. All this happened in less than 50 years. So this happened to projects that needed money, infrastructure, and everything. Think what will happen to how fast will a startup that only needs funding will move in Abu Dhabi, and it just need funding, and we are the regulatory body, so we can help you as much as we can.
So they're really open to thinking differently. That we need to support you with funding, make the regulations different. I mean, it's almost like a perfect kind of environment, I think, for startups and the communities, because you're ready for that pace of change. So one thing is we should announce. Dirk, you can announce it if you like. I'm happy to announce. So I was in Abu Dhabi back in February, and they asked me to become an advisor to the Department of Health to help support some of their ideas around digital health, academies, teaching, conferences. So hopefully I can be of a small part and play in terms of what you're trying to deliver in the future. And I didn't do it lightly. I asked some very difficult questions about if I come and advise you, support you, spend time, are we going to deliver things? And I get offered a lot of roles around the world, but I've accepted their role because I think they will deliver, because they've got the right people in place, like Dirk and others, like Abdulla, and they've got the investment and also the reasons for change and transformation. So hopefully you can join us soon in Abu Dhabi for our next edition of a conference on health tech innovation.
Yeah.
And the last ministry that was created this year was a ministry called Ministry of Nothing is Impossible. So this is
Is that great? Is that great?
This is a ministry that we have in United Arab Emirates. Yeah.
So the minister who runs that never says no.
Yeah,
Is that right? He's the guy to go to ask for cash, right? No question. Last one for you, Dirk. Anything you'd like to add?
No, I don't think biggest sandbox in the world. I mean, that's something we can also contribute. But
Great. Thank you very much for coming all this way to join us, and hopefully we can help you as a community to support your innovation in Abu Dhabi. Thank you very much, Dirk and Abdulla.
thank you.
Thank you so much. Thank you.